Hi, I'm Dr. Harold Burstein from Dana-Farber Cancer Institute, and I've been asked to share a few thoughts on the plenary presentation by Dr. Paul Goss of the MA.17R data. This was a very important study people have been looking forward to for a long time. The question the study asked was, for women who have ER-positive postmenopausal breast cancer who've had 5 years of an aromatase inhibitor, would extending that treatment out to 10 years be clinically beneficial? And this builds on previous studies that have suggested that out to 10 years of treatment can be helpful for reducing the risk of breast cancer recurrence. But those studies were built upon women who'd had 5 years of tamoxifen, and we haven't known for women who begin their treatment course with aromatase inhibitors, which is the most common strategy these days, whether longer durations would be clinically beneficial. So the study showed that on average, the extended treatment to 10 years was a little bit better than 5 years of treatment. Interestingly, there was a reduction in the risk of cancer recurrence, and there was also a reduction in the diagnosis of a new second cancer in the opposite breast. Now, for many women, the numerical benefits of this treatment were rather small. There were only a couple of percentage point differences. And so this means that the real task for the clinical team is to have a conversation with the patient, looking at the data and thinking about two things with the patient. The first is, what's their risk of recurrence in years 5 through 10? And the second is, how well have they done on treatment in the first 5 years? So for women who have higher risk cancers, typically node-positive cancers or stage 2 or 3 breast cancers, thinking about longer durations of treatment is probably going to make sense, especially if they've done okay with the side effect profile for the first 5 years. By contrast, women who've had smaller cancers have a better prognosis moving forward, or who have struggled with the side effects of this medication will probably want to stop treatment at around 5 years, and they're not missing much. In my experience talking about these kinds of conversations with patients, the good news is they will tell you what the correct answer is. You say, here's where I think you're at, and here's what you've been experiencing so far, and here's what the likely benefits are, and then they're going to look you in the eye and they're going to say, yeah, I'll be happy to take this treatment for another 5 years. Or they'll tell you, they often pull out the calendar from their pocketbooks and they say, I've already circled the date when I'm done, and that means we're done, right? And you say, yep, you're all finished, and that's good news. So it's a very important study. It does show the general point that 10 years of treatment is probably a little bit better than 5 years for most women, but we're going to be tailoring this information based on the cancer that this patient had and how well they've done with treatment to date. Thank you very much.